with Jamie today with SkinToIt.com, and we're just going to go over a cranial sacral therapy position on the neck. First off, of course, you want to start with range of motion with your body, especially with the clients. And since we're doing the neck, we're going to do range of motion on the neck. I want you to lift your head for me really fast. You can do it by rotating the head. Make sure your client is trying to be loose. You don't want them to be taut and have them jerking their head around by themselves. So you want to move their neck around, up and down motion. My favorite is the go get it girl. Go get it girl, go get it girl. Now that we've warmed up the neck, I'm just going to press down on our shoulders, trying to get those scalenes and hyoids and all the occipital muscles a little bit more warmed up than they are right now. As soon as we've done that, I'm going to have her lift her head up for me and go underneath. I'm going to start with the basic wave, which is when you have your fingers positioned under the neck, you're just holding the head in your hands and you're gently scooping up on the neck. So if I can have you lift up your head. So that's what I'm going to do. I'm just going to get her neck muscles warmed up. What I'm going to perform is the occipital base release. It's one of my favorite cranial sacral therapy holds. What it does is it releases all of the occipital muscles right below your occipital ridge in your head. This releases a lot of tension. A lot of people get headaches, tension headaches, migraines, that people are always complaining that their neck is tight because those muscles are always get tight for some reason. So we're going to do that today on her. What I'm going to do is I'm going to go right under her ridge, her occipital ridge. I'm going to push up with my fingertips like so. And I'm going to tell Jamie to slowly relax all of her muscles in her neck. Try to think about something really nice like the ocean, the waves coming in and out. And sometimes when a client's head or neck is extremely tense, when you start to do this, their eyes will start twitching and their head will actually start to move on its own because the muscles are releasing and contracting. She's having a little bit of rapid eye movement right now, which is telling me that she has very tight muscles in her neck. And as you can tell, her head has lowered down towards my hands. My goal is to have her head actually in the palm of my hands, and that'll tell me that she's fully released. And at any point, if the client starts getting a headache or feels pulsating up near the eyes, it would be recommended to stop so they don't get a migraine afterwards. Okay, so now that we've done that release, her muscles are a little less tense, actually a lot less tense. I'm going to have you lift your head up again. I'm going to do the wave one more time. And one of my favorites a lot of clients love is just working right on those occipital muscles. So if you tilt her head, you can kind of see me doing cross fiber and longitudinal friction on her neck. And then I'll switch to the other side. And do longitudinal. And then some cross fiber friction. And once you get those muscles relaxed, you can of course go and work on the lateral aspects of the neck, doing some strokes down the front. I'm not going to do the real strokes right now, and then you can tilt their head to the side and do it on the lateral aspect and keep going up and up. And when you get to the baseline, a lot of clients like you to take your knuckle and just scoop in and press down hard and go all the way to the table. And then of course you would repeat on the next side. Alright, and that's it. Thank you so much for joining us today. If you would like any more tips or any more demonstrations on our spa treatments, please join us at SkinToIt.com.